Today, we're diving into the world of medical detectives. We're going to explore how public health experts solve some of the biggest, most urgent mysteries out there.
So, picture this. All of a sudden, in a town somewhere, people start getting sick with something totally new. The news is buzzing, people are getting scared. How do you stop it? Well, before you can even think about a cure, you have to find the cause. And that is the big question.
And the people who tackle that question are a very special kind of investigator. They're not dusting for fingerprints or using magnifying glasses. Their clues are found in data. Their crime scenes can be entire countries. And their job is to be the detectives of public health.
Now, this kind of detective work, it has a name: epidemiology. And it's not just a cool name, it is the absolute core science behind everything we do to keep the public healthy. Okay, I know, that definition is a real mouthful, so let's break it down. Distribution is all about finding the patterns. Who is getting sick, where are they, and when did it happen? Determinants, those are the causes, the risk factors, the why and the how. But the most important part, really, is application. That just means using all that knowledge to actually get in there and solve the problem. So you see, epidemiology isn't just about counting cases. Nope, it's a real, hardcore science that uses stats and solid research to figure out what's going on. But, and this is the cool part, it's also a tool. It's a way to turn all that science into real-world action that keeps all of us safe. All right, so every good investigation has to start somewhere. Before our health detectives can crack the case, they first have to map out the entire mystery. This first phase has a name. It's called descriptive epidemiology. And really, it's all about getting the basic facts of an outbreak down on paper. Think of it like creating a suspect profile for the disease itself by asking those three huge questions. Who's getting sick? Where is this all going down? And when did it start? And you can see right here how this really guides the whole investigation. For person, our detectives are looking at demographics, age, sex, things like that. For place, they're literally mapping it out. And for time, they're looking for trends. Is it seasonal? Is it a sudden spike? All this data comes together to create the very first sketch of our culprit. Okay, so now we've got the scene all mapped out. The real detective work is about to begin. It's time to start connecting the dots and finding out what's actually causing this.
This next stage is called analytic epidemiology, and this is where we move beyond just describing what's happening and start figuring out why it's happening. Investigators start comparing different groups of people, hunting for those clues, the risk factors that are behind the disease.
So how do they do this? Well, they've got two main strategies. The first is a case control study, which looks backward. You start with the people who are already sick, and you dig into their past. The other way is a cohort study, which looks forward. You start with a group that was exposed to something, and you follow them over time to see what happens. Let's make this a little more real. In a case control study, first you find your cases, the sick people, and your controls, a similar group of healthy people. Then you match them up on things like age and sex, just to make sure it's a fair comparison. Next, you look back and measure what they were exposed to. And finally, you analyze everything to see if one particular exposure pops up way more often in the sick group. But, even the best detectives have a weakness, a kind of kryptonite. And in epidemiology, that kryptonite is called bias. It is the single biggest threat to finding the truth, because it can twist your results completely. Maybe there's a hidden factor you didn't see, or maybe sick people just remember things differently than healthy people do. The point is, a great epidemiologist is always on the lookout for these hidden traps.
So, let's say you've done the work. You've identified a prime suspect, a likely cause for the disease. But how do you prove it? Beyond a reasonable doubt. And how do you test your solution?
Well, for that, you need what's called an experimental study. These are the absolute gold standard in science, things like randomized controlled trials. They give us the strongest evidence possible because researchers can actually introduce something new, like a vaccine, to one group and not another. That's how you can definitively prove cause and effect. Now, another huge part of taking action is screening. Screening is all about being proactive. Instead of just waiting around for people to get sick, you go out and test people who seem perfectly healthy to try and find a disease early on, when you can actually do the most good. But here's the catch. No test is perfect. This little grid shows the 4 possible outcomes. A test can be right in 2 ways, a true positive or a true negative. But it can also be wrong in 2 ways,
A false positive, which causes a ton of unnecessary worry, or a false negative, which is even scarier, because that's a missed case. We actually measure a test's quality in two main ways. First, there's sensitivity. A really sensitive test is fantastic at finding the true positives. Think of it like casting a super wide net that's designed to catch every single person who actually has the disease. You don't want anyone to slip through. And on the flip side of that, you have specificity. A highly specific test is excellent at identifying the true negatives. It correctly gives all the healthy people the all clear. The tricky part is that a great screening program needs to find that perfect balance between catching everyone who's sick without raising too many false alarms. So we followed our detectives all the way from the first clue to the final test. Now let's talk about the most important part of all. What is the ultimate goal of all this hard work? And it all comes down to this one simple idea: protecting the public. These investigations help us understand how big a problem is, they guide how we control it, they stop it from spreading, they save lives, and, in the end, they help us create smarter, better health policies for everyone. And this brings us right back to where we started. Remember that long definition? Well, that final phrase is the most important one, the application of this study. Epidemiology is not just some academic exercise, it is science in action, and it's for the good of all of us. It's this incredible silent science that protects us every single day from threats we might not even see. So next time you're out and about in your community, try thinking like one of these detectives. What kinds of health patterns do you notice? The answers might just surprise you.